Hi, I'm Dr. Michael L. Johnson. I'm a board-certified chiropractic neurologist. I've been in practice in Appleton, Wisconsin since 1983. I'm the author of this book, What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. I literally wrote the book on fibromyalgia. And I'll give you a free copy of my book if you decide to come into my office after watching this video. I also consult with over 1,000 doctors across the country in how to treat fibromyalgia. And you can go to our website, lifechangingcare.com, lifechangingcare.com. And you can look at testimonials from other fibromyalgia patients that I have taught to the doctors exactly what I am showing you here today on this video. So, what makes us different from every other doctor you have seen? If you have fibromyalgia, my guess is you've seen at least 20 doctors. And it's Russian roulette with medications. Try this pill, that didn't work, try that one. Ooh, Lyrica! Lyrica, it's the heal-all for fibromyalgia. Now, it may work for some people, but it hasn't worked for a lot of other people. Lyrica is an anti-seizure medication. It's an epileptic medication. They didn't design this drug for fibromyalgia. Man. So, what makes us different from all these doctors? We treat you neurologically and metabolically, right and left hand. You're watching this because somebody you know or yourself suffers from fibromyalgia. So I'm here to tell you we don't leave any stone unturned to get the exact cause of your fibromyalgia. How do I successfully treat fibromyalgia? Neurologic and metabolic treatment. So we're going to cover the metabolic side first. We're going to do specific blood tests. Now I know you've had blood tests, you've gone to your doctor, everything's normal. Let me tell you, there are lab ranges which are very broad, and there are optimal ranges which are a lot narrower, functional ranges. For instance, TSH, thyroid stimulating hormone. Your thyroid controls your metabolism. Many fibromyalgia patients have thyroid and or adrenal problems. You don't know unless you test. So, run a thyroid panel. We're going to run a complete metabolic panel. We're going to run a lipid panel, and we're going to run a CBC with autodifferential, looking at red and white blood cells. Well, I had those tests. They're all normal. No, they're not. I guarantee you they're not optimal levels, functional levels. So we can assess your thyroid, adrenal glands, liver, kidneys, red and white blood cells, gut function. All of these internal organs can have a play in why you have fibromyalgia, especially that thyroid and especially the adrenal glands. We're going to run sensitivity testing. Many, I won't say all, but many fibromyalgia patients are autoimmune. Their immune system is attacking their nervous system and their brain. That's why they have chronic pain and fatigue. If you haven't figured it out, and I'm sure you have, because you're suffering with it and you're watching this video, fibromyalgia basically means you are constantly fatigued and you are constantly in pain. I mean, it is work getting through the day. Remember, I wrote the book on it, and in the book is the neurological side of fibromyalgia. I'm working on my second book, which is the metabolic side. So sensitivity testing. We want to see if you're sensitive to gluten. What is gluten? Wheat, rye, oats, barley. We want to test to see if you're sensitive to milk, eggs, yeast, and soy. If you're sensitive to any or all of those, you have to eliminate them from your diet because it's causing inflammation in your diet. Here are some of the symptoms of these sensitivities. Chronic pain or fatigue, which you have if you have fibromyalgia. Frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers or sores. I had one fibro patient. This test is measured in units, and normal is 0 to 10 units. She was at 400 units. We got her off her sensitivities, and it may just not be gluten. That's why you run the tests, and guess what? 80% better. And they vomit often. I don't have anybody said they vomit often. So a lot of fibro patients have bowel issues, IBS, irritable bowel syndrome, digestive problems, constipation, diarrhea, back and forth. It's because they have sensitivities to gluten, milk, soy, eggs, and yeast. You need to run the test. The adrenal glands are involved in just about every fibro patient because fibro patients, they have problems with insomnia. They're not sleeping. Some of them need medications to sleep. Well, that has to do with cortisol levels. So we run an adrenal stress index, and it measures your. It's a salivary test and a DNA swab, and it's measured 4 times throughout the day: 8 a.m., noon, 4 p.m., and 10 p.m. And if your cortisol levels are skewed, you're not sleeping, or you have blood glucose issues. And this is a problem, and it needs to be addressed, especially if you're suffering from fibromyalgia. Next, on the metabolic side, we test immune panels. There's 2 parts to your immune system, Th1 and Th2. Remember I said earlier, fibromyalgia patients, oh my gosh, the vast majority are autoimmune. Their immune system is attacking their nervous system. That's why they're chronically fatigued. That's why the fact that they have chronic pain. Shoulder pain one day, leg pain the next, lower back pain. Can't figure it out. What's going on? Here, take this medication. It's an anti-seizure medication, but you know, on TV they advertise it for fibromyalgia, so here, take this. It'll help you. Oh my God. Russian roulette with drugs. I guarantee you, if you walk in my office, you've probably been there. I'm not saying stop taking your medication. Don't misunderstand me. That's called practicing medicine without a license. I am saying once we get you better, go back to your MD and ask if he can get you off these meds. And if they won't, find another MD. So immune panels, there's 2 parts to your immune system, Th1 and Th2. You want to find out if one is dominant. How do you know if one is dominant? Through blood tests. If you're Th1 dominant, you're going to have high markers. The markers are TNF-alpha and interleukin-2. If you're Th2 dominant, the high markers are interleukin-4 and interleukin-10. Interleukin-4, interleukin-10. The only way you can tell is through the blood work. Now, you notice my slip there? A lot of fibromyalgia patients suffer with brain fog. They kind of seem out of it. Or things are on the tip of their tongue and they can't get it out. That's Broca's speech area, this frontal part of the brain, and we'll get into that on the neurological side. It's not firing. See, I know fibromyalgia. I teach other doctors how to fix it. I know how to fix it. And then you have these fibromyalgia sites where they're accepting all this money from these drug companies, so they don't want to hear any of what I'm telling you. They don't want to hear it, because you know their funding would be cut off in a minute. You don't need these medications because they cause side effects. Look into them. Again, if you're taking meds, I'm not telling you to stop. I don't want to get my butt in a bind. I'm just giving you my honest opinion. So, Th1, interleukin-2, TNF-alpha, Th1 is T cells. T cells are the army that goes and attacks, and it cleans up afterward. These are helper T cells, suppressor T cells, natural killer cells, regulatory T cells, macrophages. Th2 is B cells. B cells make antibodies. They tell the T cells what to go and attack. So, say for instance you have fibromyalgia, you're Th1 dominant. Well, what's causing that dominance? We want to find out. Is it an active antigen or is it dysregulation? Let me tell you what an active antigen is. It's a parasite, bacteria, virus, mold, yeast, fungi, protozoan. Foods can be active antigens. That's why I'm talking about the sensitivity test. Chemicals, heavy metals. The best indicator for an active antigen as the cause of a patient's abnormal dominance is the helper-suppressor T cell ratio. It's called CD4 and CD8 ratio. If it's 2.5 or above, it's an active antigen. If it's 1.2 or below, guess what, folks? It's dysregulation. Could be blood sugar, could be a problem with the adrenals, could be anemia. You don't know unless you test for it. So, you could be autoimmune. If you're autoimmune, you need to run the immune panels. Another active antigen is H. pylori bacteria. You can run a test for it. If you're a fibromyalgia patient, you probably have leaky gut syndrome. Leaky gut, it describes a condition of altered or damaged bowel lining caused by